We're empowering patients. We're not trying to replace doctors.
This is like having the best chief resident kind of working for you and getting all the information from the patient before passing it up to you as the doctor to treat.
Today, we're sitting down with the minds behind Doctronic, an AI-based healthcare platform that offers instant consultations and affordable video visits with licensed doctors. Tell me kind of step by step, what does it look like for someone who wants to go in and access Doctronic, and who is this program really built for?
Doctronic runs on a website, right? It's doctronic.ai. You can just go in there and start a conversation where it's only going to ask what your age and your sex is. And then you're going to have a conversation with the AI discussing your health. And at the end of this conversation, what it's going to do is it's going to say, there are 4 potential problems that you're facing, and here are 4 potential solutions. And now here's the information for you to go take to your doctor in order to get treatment.
Tell me about the genesis of Doctronic. Where did this kind of begin from? What were the early conceptualizations of the product?
When you have a healthcare problem, what's the first challenge you have? It's always, how do I reach out and touch the healthcare system? It's always difficult. And so we started with that problem. We said, how do we improve access? And that is actually our guiding light for everything we build, right? We're very patient-focused. We want to solve for problems that patients have. And for us, the only problem that people really have is getting access to the system.
How does this fit in with the larger ecosystem of the health system? Because it's not really meant to stand alone and be the end-all be-all. This isn't
Correct.
Like the finish line, right?
This is a platform where people can start to get that information and then optimize their communication with their doctors.
We like to say we're empowering patients. We're not trying to replace doctors. Healthcare has always had this fundamental math problem out there, which is supply never meets demand, right? You know, there's just way too much that people want from the healthcare system, and healthcare providers can never actually meet that need, right? And so you don't need to replace healthcare providers with a system out there. You can actually just fill that void.
This is like having the best chief resident kind of working for you and getting all the information from the patient before passing it up to you as the doctor to treat, right? And that's what we're doing, right? We're not replacing doctors at all.
It can synthesize that information, and so when you come back, it can say things like, I noticed that you also had a headache 2 weeks ago. Is this similar to that headache, right? And that's where the real power of a system like this comes in.
And what is do you have numbers on, for example, is it X% is the first guess is correct?
We see when a user actually goes to see one of our doctors that about 70% of the time, the diagnosis and treatment plan exactly match.
Tell me about the business behind Doctronic. So 10 million consultations, 50,000 weekly users. What is the kind of business model behind it, and how are you thinking about building a sustainable and financially solvent business with producing something that's actually giving good health advice?
First, we want to make sure that the AI is always free, right? That's kind of one of the fundamental tenets of what we're building here. And so we make money when you pay for a doctor's visit. We think that there's a very near future where we are helping people navigate the healthcare system.
It really should be this point of first contact, right? Where you don't have to think about, how do I find this specialist, or how do I find this doctor? You just go to Doctronic and you say, this is what's going on, I need help with this, help me navigate the system. And then beyond that, the AI can do things that doctors could never do, which is check in on you a day later. There are a huge amount of Americans out there that don't have primary care doctors, and there are a huge amount of Americans out there that are probably an hour or 2 away from the nearest doctor, right? And so this is really important for them as well.
Yeah, and you know, we're charging $40 for a visit, right? And so we're pricing this to be affordable, right? We're not trying to build a system that is just another one of these systems where wealthy people get better healthcare. Lots of people are underserved by, in this country, I'd say the majority of people. And it doesn't get solved by just giving people immediate access to more doctors. That's not even possible, but even if that were, right? It gets solved by helping all of the doctors that are practicing, like giving them better information. And when you can do that, you can actually really raise the floor of healthcare. You can give everybody better healthcare, and that's incredibly important, right? We have a system that is failing a lot of people, and we're hoping to build a solution for that.